My understanding at this stage in my career, which has evolved over the years, is that health is that which is the way it was designed to be. Human body was designed to be a certain way. It was designed to function in a certain way. You see it commonly among people, and the potential is great. And when unobstructed, it functions that way.
All the systems work together very efficiently unless there's been an injury. And that interdependent relationship is one of the things that brings us to health. We need that.
The human being is designed for perfect function. It's got all kinds of built-in mechanisms of self-repair, self-regulation, ways to adjust. So for me, a big part of health is that ability to shift in response to demands. Demands internal, demands external. Whether we call it stress or not, the ability to shift in response to any demand is a function of health. The unhealthy organism is not able to make those shifts, is not able to adapt in the moment or in the long run to remain functioning freely and at a high level.
Where things have become so unbalanced that the body's ability to recuperate or recover have exceeded its natural ability. And then it proceeds down a disease continuum pathway. So for example, when you're talking about someone with diabetes, if the diabetes goes undiagnosed and unchecked for a long period of time, in which a lot of patients, this is the common occurrence, they don't get diagnosed until symptoms appear, but yet the process has begun years ahead of that date of diagnosis. The damage is being done all throughout. There are compensatory changes that happen both on a cellular level and a more gross level, where the body begins to change and remodel. And this change and remodeling that happens leads to the further progression of the disease process. So this is a diseased body where it loses that capacity to heal and recover, whereas a healthy body that has these 5 models working together synchronously, the neurologic model, the biomechanical model, the metabolic, biopsychosocial social model, all these models working together work synchronously to maintain health and homeostasis, and are able to absorb insults, so to speak, from the environment, from whatnot, and the body can recover from those insults, whereas a diseased body cannot.
You know, the river wants to flow, and if there's a boulder that rolls into the stream, it's going to dam up the river. When something's interfered with a healthy expression of the vitality of the person, that energy is going to express as best it can. And if the normal healthy channel isn't open, it will come out in a form of some kind of distress or disease.
The osteopathically trained physician is interested in what's causing this human being as a whole organism to suddenly be susceptible to a particular illness, to get an infection, to have asthma, to have nerve paresthesias and numbness running down their leg. What are the variety of factors contributing to this organism having a compensation that results in what we perceive as disease, illness, dysfunction?
And those instances in which such injuries or insults don't disappear completely, if you trace it back, what you find is that a force was overwhelming enough that the body can't gain leverage, or the person's own system of self-correcting mechanisms can't gain leverage enough to make the correction, to free itself. So, for instance, a physical trauma, a chemical trauma, an emotional trauma, all of these, an infectious trauma, you could call that a type of trauma, an infection, we just say in medicine. All of these can overwhelm our system. And the great thing about osteopathy is that we have tools to deal with any of these insults.